Ulysses Slaughter here with Steve Fischer of Building Community. This is the Chester Housing Authority's platform for staying connected with residents, with supporters, in and outside of Chester for that matter. And we're going to be talking today with three business owners who've been doing some very hard work, some faces you may recognize, maybe you don't recognize it, but today you're going to get to know three incredible business owners here in the city of Chester. But before we get into that, I want to introduce Steve Fischer, who is the executive director of the Chester Housing Authority. We've been at this now. What's this, episode number 23, Steve?
22.
22. I'm ahead of myself.
Somebody's got to keep the books.
Thank you so much, sir. I think if somebody were looking at this screen and all of us were quiet and they looked at the pictures, they might think our next guest was actually the one who was heading this up. Because if I'm not mistaken, Ms. Woods, is that a microphone in front of you?
Yeah, I went professional on y'all.
She comes with her own props.
I'm thinking, so is there like a theme song before you start to talk or something?
One thing that I've done, and I did this through COVID, was I started a podcast. So I have a weekly podcast called Keeping It 100. Comes on Wednesdays, 12:15. And so when I first started doing the podcast, we covered all COVID topics. We talked about how the vaccines were made. We talked about clinical trials. How are things different since the Tuskegee Airmen? Oh, wow. You're good, Steve. That's why you're the chairman of the board.
We've been wanting to talk to you about the name of that podcast.
Oh, y'all got that? Did y'all steal my podcast title?
I was thinking we had that copyrighted in 2017.
Check the trademark books.
That's what they say about it. They've been saying that about Taco Tuesday too. But anyway.
Yeah, we named our annual report that one year, 2017.
That's a good, and your annual report is really impressive each year. So kudos to you for that. But yeah, so we, covered all the different topics related to COVID and, just try to get the information so that people can match how they felt with what was, really happening in real information. And then after a few months, I just it was nothing else to talk about in terms of COVID. We covered everything that we could cover, and we switched to just, chronic health conditions. And so we have done shows on diabetes, heart disease, or alcohol abuse. We do a lot of mental health talks. June, we're currently doing shows on fatherhood. June is Men's Health Month. So all of our shows in June, we have a male provider on talking about different aspects of men's health. We do, cancer prevention. So just all the different things that disproportionately affect Black people or the topics that we cover. And I bring on, so it's not me talking about these things because I'm not an expert in these things. I bring on professionals who come on and talk. So the scientists, there's physicians, there's nurses, there's therapists, dietitians, fitness trainers who come on and talk and share their expertise with us. And so that's how we keep the conversation going and how we make sure that the community has the information that they need to make good health decisions.
So Kristin, before we start to wrap this up, how do people get in contact with you, and who should be reaching out to you for the services that you provide?
Anyone that's in charge of the bank account at their institutions. No, we're actually planning a health conference in the fall. So we are really trying to do something to impact health equity. And so we're planning a health conference in the fall. So if any organization wants to get involved in that on any level, we are definitely looking for sponsors as we start to put the pieces together. And then anyone who is looking for projects related to community health education, training healthcare providers, or exposing young people to careers in healthcare. I'm actually hopefully I'll be working on a project with Chester Education Foundation to train young people on passing the pharmacy technician certification exam to get them careers in pharmacies and hopefully be able to inspire them to pursue pharmacy school. So lots of project management work around health equity, health disparities. If people, I'm trying to think. So for community members that may need help, just, trying to navigate the healthcare system, health insurance, if they don't have a healthcare provider, I get on the phone with people and, try to connect the resources to them. Anybody that can, who needs help can contact me at 484-234-2427. Again, 484-234-2427. The website, like you mentioned, is healtheducatedinc.org, healtheducatedinc.org. And so you can learn more about the organization there, or you can email me at healtheducatedinc@gmail.com.
She last mentioned about a conference. This woman knows how to put a conference on. 3 years in a row, back pre-COVID, she had me working with her on the Healthier You conference. Those things were enormous successes. I think 2 years we held it in Philly, 1 year in Delaware County, right?
Yep.
Huge turnouts, great sessions, and she just has a way with understanding, what subject matter will appeal to, broad group of people. And so if she's got another one in the works, pay attention. It'll be good.
We have another one in the works, Stephen A.
Oh, there she goes again, dragging me along. It's a good drag, though.